the wine industry about job losses as a result of this lockdown ban. Well, an umbrella body representing the liquor industry is lobbying for alcohol to be sold so it can be consumed at home during the level 4 lockdown period. The SA Liquor Brand Owners Association, which represents manufacturers and distributors in the liquor industry, said on Friday that it was in talks with government to pursue off-site consumption. We're now joined via Skype by the Southern African Alcohol Policy Alliance Director, Maurice Smithers. Thanks so much indeed for joining us. Welcome to the programme.
Thank you, Peter. Thank you for having us.
All right, so level 4, great news for cigarette smokers, but not for the alcohol industry.
Correct, yeah. Although I must say that your previous clip about the wine industry, government is in fact allowing the export of wine. So that is a positive aspect to the to level 4 regulations, at least for the workers in the wine industry that sector is worried about. Yeah.
All right. So, what's your view then on alcohol still not being allowed to be bought and sold during level 4?
Look, we were very surprised when government banned alcohol altogether. That hasn't been the global pattern. The global pattern has been to close down all on consumption and then to reduce access to alcohol off consumption. So we were surprised when government took the decision it did, and it's been followed actually by other Southern African countries and a few others in the world. But we are impressed that government has apparently reached consensus on the potential for liquor-related harm during the lockdown. The Minister of Health, Dr. Mkhize, said, for example, that to defeat the virus, we have to rely on people's sober judgments to conduct themselves in a way that they can encourage the 3 key rules, which is physical distancing, people following coughing etiquette, and hygiene. And he said, the reality is that alcohol reduces an individual's capacity to do this. We all know that what happens when people get drunk, they can become extremely ungovernable. In addition to that, there's been an incredible decrease in trauma admissions to hospital as a result of alcohol. That not only has resulted in less alcohol harm, but it's also freed up beds for the potential need that is being caused by the virus as it approaches its peak. And the third thing, which has been made clear, is that alcohol actually has a very negative impact on the human immune system, making us more vulnerable to the virus, especially if people have got underlying issues. So all of those issues, including the higher risk of domestic violence as a result of alcohol being in the home at this time, all of these, we agree with government that they make sense, and we agree that it's probably a good thing to keep the ban at this point in time. We notice that at level 3, there's an introduction of limited access to off-consumption alcohol, and gradually in level 1 and 2, there'll be more access. The point is, nobody's calling for a complete ban on alcohol in the future. It's really just what contribution will the ban on alcohol make to helping to reduce the threat of the virus at this time. And we think that government's position is correct on the matter.
Some people will say that, wherever there's been alcohol prohibition in history, all that's happened is that a black market surfaces and people make alcohol which is not safe. So is there a danger perhaps that a too prolonged ban on alcohol sales may bring unintended consequences?
Of course. And I think that that's one of the... Look, I mean, the whole lockdown is bringing unintended consequences. And that's the difficulty that government has in trying to make decisions about how to manage the process. And I think that this new approach of the 5 levels, where they're making very considered reductions in the restrictions to try and bring the economy back, I think is a very good approach. And obviously, we don't want to see people selling liquor illegally. We don't want to see people also producing dangerous concoctions. So yes, ideally it would be good to get back to a situation where people who do want to buy alcohol can do that. But we also think that one of the useful things that's happened around this time is it's made both ordinary individuals and government themselves reflect on the levels of alcohol harm in the country generally. I mean, there's an interesting statistic. Currently, we have, with the virus, after more than a month, we have 75 deaths. The reality is that alcohol kills, alcohol-related deaths in this country are 171 per day.
Wow.
That's in normal society. That, of course, has become reduced now under the lockdown. And we need to consider, do we want to carry on with that?
Unfortunately, I'm going to have to cut you off there. I'm so sorry to do this, but I think we've got the gist of what you wanted to say. But thanks so much for your contribution. We have to leave it there because there's been an immediate turn in the right direction by the Eastern Cape Health Department after oversight visit by the Minister of Health to the province. The unsatisfactory state of readiness for COVID-19 in the province prompted